My name is Ignacio Duarte, MD. I'm an adult cardiac surgeon. Probably our most common procedure that we perform as cardiac surgeons is coronary artery bypass grafting. That's typically when a patient comes in with either angina or a full heart attack, if you will, as a result of blockages in the heart arteries. So that's a procedure where we use arteries and or veins from the legs to bypass the blockages to help oxygenated blood flow to the heart muscle beyond the blockages. We also perform surgeries on the valves within the heart, typically the aortic and or the mitral valve. Those valves can become either stenotic or regurgitant, don't open fully or don't close fully, and can result in congestive heart failure and need surgical intervention. We also perform surgeries on the aorta for aortic aneurysms. In cases of emergencies, aortic dissections are also procedures we take care of. I think those would probably be our most common adult cardiac surgical procedures. For me, what's important, probably for both of us in our practice, what's important is developing a relationship with the patient and the family, not just seeing it always as a case, as a procedure to do, but knowing that you're touching somebody, you're impacting their life, their children's lives, their family's life, their relatives' life, and that's a great responsibility. I think one of the things that we're most proud of is for consistently being able to achieve a Society of Thoracic Surgeons 3-star adult coronary bypass graft standing. It's only about 10 to 12% of programs across the country merit that, and we've been consistently one of those. I think that shows a lot of commitment, dedication, professionalism from everybody, from the OR team to the ICU team to the nurses to the floor nurses. Our physician's assistant and other care extenders are all in and trying to create the best outcomes for all of our patients.